Assalamu alaikum wa rahmatullahi wa barakatuh. For this session, we'll start with sleep and comfort. So, in this session, first we will start with the factor affecting sleep. You know, in our life, mostly we are spending around 1/3 of our time at sleep. So, it is from the most common activity that we are doing, or loss of activity that we are doing in our life. The factors that affect our sleep, we will not be able to sleep well if we are sick, if we are having fever, if we are having difficulty in breathing, if we are having pain. It is difficult to start sleeping while we are having any illness. So during illness, mostly we will have difficulty either in sleeping, or the quality of sleep, it will be disturbed. We might awake at night, we might awake early morning due to the pain, due to the fever, whatever the disease is causing. Also the environment. The environment, in order to sleep well, we have to have a quiet environment, a quiet, restful environment. It means that we have to be away from noise that will affect us. If we are living beside a main road or a highway, in this case, we might have a difficulty in breathing, and we might awake up during sleep due to the sound of the cars or large vehicles that are going around during that time. Also, we have to set the light. It have to be a dim light or dark, in order to help us in getting sleep. Also, the weather itself, if it is high room temperature or very low room temperature, in this case, it is difficult to sleep in those situations. The lifestyle that we are doing. If you are usually doing a very minor work, if you are living a sedentary life, in this case, your body, you are not paying an effort at the daytime. So sometimes it is difficult to initiate sleep for those people. But those who are doing extraneous work, when they are going to bed, sometimes, even though they are going to sleep even without taking their meal. So it depends upon how we are living and how what we are doing at the daytime. The emotional stress, if we are having anything, that stressful situation, also it will affect our sleep. And if we are thinking of any problems that is there, in this case, also it will affect our sleep. Stimulant and alcohol. If we are taking stimulant at night, especially before the time of going to bed, in this case, we might face difficulty in initiation of sleep. Like if we are taking coffee, if we are taking tea, any kind of stimulant or stimulant drugs. Sometimes those who are taking stimulant, caffeine or any drugs, sometimes rather than caffeine, in order to keep them or to have a long period of time for study before the exam. Also, it is not advisable. Those things, it is not advisable, and we should not take them, because those will interfere with our sleep. And also, we might be awake for a period of time, but we will not be able to conceptualize what we are studying and what we are doing. That also, the stimulant like drinks or tea and coffee, sometimes also they are diuretic. So we might rise from bed at night in order to go to the bathroom. Alcohol. Those who are taking alcohol, they might not be able to sleep without taking alcohol. And also they might, it is acting as diuretic also, so they might wake up in order to go to the bathroom for that. Diet. They found that the diet also itself, there are some food that might be helpful in sleep, like protein. If we are taking a protein during the night, if we are taking a cup of milk also before sleep, it might be helpful for us to go to sleep and initiate the sleep. Smoking, it might affect also our sleep, motivation toward sleep, and also medication. If we are taking medication, there are many variety of medication. Some of them, they might interfere with the sleep. Some of them, they might introduce or induce sleep, like painkiller, like strong analgesic, narcotics. All of those, it will affect sleep. The common sleeping disorder. In sleeping disorder, we have the first common and the most common one, which is insomnia. Insomnia, it is inability to sleep or remaining sleep. So it is the most common disorder. It is divided to 3 types. The first one, which is acute insomnia, which is one of the, which in this case, it happened one or several nights, and it is caused mostly by stress. The second, or it might be due to acute disease. So it is for a short period of time. The chronic insomnia, it is longer than 1 month. So the client will experience an insomnia or difficulty to initiate or to sleep for longer period of time, more than 1 month. A chronic intermittent insomnia, it is coming and going. So it is for the whole, it might be for the whole life, but it is not for every day. So he might have a period of time or period of 1 week or 2 weeks that he will sleep well, but after that it is followed by 2 or 3 days that he couldn't sleep properly, and this will come mostly regularly. The risk factor here, the older people, they are mostly facing this problem, which is insomnia, and also females. So old people, they might go and initiate sleep properly, but they might get up from bed many times during night, or they might get up early in the morning. Some medication, it might have stimulant like caffeine or other type of stimulant that interfere with the sleep of the person. It's treated by the following. So controlling of stimulant within the environment. So to control the environment, like as we said before, the light should be dim light or no light at all. Avoiding noise producing instrument. By that, we will have a quiet environment. Also, a good restful bed and mattress, the pillow itself, the cover, and the room temperature. So the room temperature, it should be within around 21 degrees centigrade. Cognitive therapy or positive thought and beliefs. So we have to thought always positively. If we thought negatively, this will affect our sleep and will affect our life and all activities of the day. Thinking positively here regarding sleep, if we are thinking that for this night we will not be able to sleep, this thinking itself, it will arise the problem and you will not be able to sleep well. Sleeping restriction also. So if there is restriction of sleep here, to restrict the sleep at the daytime. If we restrict the sleep at the daytime for that client, and if it is even if it is needed during the daytime to be a short nap, not a very long nap. So don't say that I'm unable to sleep at night while you are sleeping 5 hours at the daytime. So you have to restrict your sleep at the daytime. By that, it will be helpful for you to sleep at night. And also, it is advisable to go to sleep at the same time every day. By that, your biological hours, it will be seated at that time. Otherwise, if we are changing our time of going to bed every now and then, this will interfere with our biological hour. So, and the hormonal changes. So it will affect the ability to sleep. Hypersomnia, which have sufficient night sleep but cannot stay awake during the daytime. So he is sleeping at night, and also all the day he is feeling sleepy, and he might sleep. It's caused by medical condition like central nervous system damage. In case of central nervous system damage, either brain head injury, brain infection, encephalitis, any case like this. In case of kidney disease, you know that the kidney function is to get rid of waste product from our body. So if it is not functioning well, in this case, the waste product or the toxic material, it will be high, and it will affect our brain, and it will affect our sleep. The liver also, from the main function of the liver is to do detoxification of all the chemical substances in our body. So if it is not working well, in this case, also the level of toxic material in our body, it will be, which is the end product of metabolism, it will be more, and it will affect our brain. Mental disorder, those who are having mental disorder, also it will affect their sleep. Those patients with diabetes, the level of blood sugar, also it will affect the sleep. Narcolepsy, which is excessive daytime sleeping, it's caused by lack of chemical in the area of central nervous system that regulate the sleep. So in this case, the client will sleep too much during the daytime. Patient has usually muscular weakness and also sometimes hallucination. Sleeping apnea, which is frequent shortness of breathing during sleep, it is more than 5 episodes by each night, longer than 10 seconds. It is considered, in this case, abnormal. If it is less than 5 episodes and less than 10 seconds for each episode, in this case, it is normal. But if it is 5 episodes or more, and it is longer than 10 seconds for each episode, in this case, it is considered abnormal. In order to breathe well, the airway has to be open. So the airway has to be patent. So the air can go inside from the nose to the throat to the bronchi to the lungs easily, and in and out. Breathing in and breathing out will be easy. And in this case, apnea will not happen. If there is any condition that interfere with the airway patency, so if the airway is not opened well, in this case, sleeping apnea is happening in case of blockage of the airway. So the symptom in this case, loud snoring will be there, frequent awakening, and also excessive daytime sleep, difficulty in sleeping at night. Morning headache, so you will have morning headache, irritability. So those are the signs that happen that the patient is having if he is having sleeping apnea. Can occur in all age. The frequency range from the age of from 50 to 60. It drain the person energy and lead to excessive daytime sleepiness. It affects the person work, and also it will affect his performance in school. So those who are having this problem, they are facing low performance or at the school. It increases the blood pressure and cardiac, it might lead to cardiac arrest. So their chance for getting cardiac arrest will be more. It is divided to two: obstructive apnea, which is due to obstruction of the airway, the central apnea, which is due to the central nervous system from the brain after head injury, or it can be mixed, which is combination between both of them due to obstruction and central apnea. Insufficient sleep, which lead to fatigue, reduce also motivation to do things, reduce concentration. When there is reduction of concentration, in this case, you will be more prone also to accident. Parasomnia, which is a cluster of walking behavior that appear during sleep and interfere with sleep. So in some person, they wake or they come out of bed during sleep and they can walk out while they are sleeping. Assessing sleeping pattern. In order to assess for assessment of any one who is having difficulty in breathing, we have first to take the sleep history. Taking the sleep history, we have to see the usual sleeping pattern. When he is going to bed, usually. Especially sleeping and walking time. So we have to specify the timing for to get a specific time or to have a specific history from the client about his sleep, when he is going to sleep, how many hours did he sleep every night, hour of undisturbed sleep, how many hours he is sleeping without any disturb, without any waking up during that sleep, the quality of his sleep, how he feel about the quality of his sleep, and the time and duration of naps at daytime. So for how many hours or minutes did he sleep at daytime? Bedtime ritual, what he is doing before going to bed. Is he reading a Holy Quran? Is he reading a book? Is he doing some tasbih or any dua or anything like this? So this we have to know about it. Using of sleeping medication. Is he using any sleeping medication or any sleeping aids? What's the effect of it? Sleeping environment. Where did he sleep? Did he sleep alone? Is it a quiet environment? What about the light? So all of those things that we spoke about it in the previous slide, we have to also assess it. Recent difficulty in sleep. What's the problem that he is having and when it is started? for how long, and what's the change in his sleep. Health history, physical examination of the client, we have to see the appearance of the client. In the physical appearance or facial appearance, you will see if he is having difficulty in sleeping or problem with sleeping, you will see the buffness of the eye, buffing of the face, blackness around the eyes, red eyes. Always he is sometimes touching his eyes, rubbing his eyes, yawing. So all of those signs, it is a sign of lack of sleep. How he behaves, also yawing, and also getting anxious or easily provoked. Energy level, how he feel about his ability to do his work. Is he doing his work with a good energy, or does he become tired while he is doing his usual work? Then the sleeping diary. Sleeping diary, it is difficult for the client sometimes to do it by himself. So if anyone is sharing him the room, so he might observe him and he might keep the sleeping diary. Sleeping diary means that we have to have a schedule or to write on it when he is going to the bed for a period of time, might be week or more, in order to evaluate his type of sleeping. Then when he try at that night to sleep, to fall asleep, any awakeness during that sleep, how many times did he awake during the sleep, and the duration for each one, awakening at the morning, at what time did he awake, and also activity that he performed before bedtime, what bedtime ritual that he did he take medication before sleep or not? Is the medication, what type of medication if he is taking, does it have an effect on sleep or not? Presence of any worries, did he have any problem that he is thinking about? So all of those things, it has to be evaluated. Then the intervention to promote normal sleep. In the intervention of promotion of normal sleep, we have to teach the client. Client teaching, it includes the avoiding anything that interfere with sleep and rest, like the diet. It's one of the supporting thing. So we will teach him about the diet. What's the thing that he should avoid at night? What the fluid that he should avoid to take it at before the bedtime. Also, regarding the day naps, how much it should be and or should not be there. Support time, a bedtime ritual. So we have to tell him to use some bedtime ritual, like reading from a book, reading a story, reading from the Holy Quran, dua, tasabih, all of those things. Creating restful environment. The environment itself, it should be quiet, as we said before, calm, away from any noise. The room temperature should be set well. The bed also should be clean and soft. The pillow, the cover, all of those things. Promote comfortable and relaxation also. It should be enhanced and enhance sleep with medication, which is the last choice. So when those supportive measures are not working, he has to go to medicine. But if those measures can help, don't start with the medication. Start with alteration of your lifestyle, and start with alteration with your daily life activity, start with avoiding the day naps for a long period of time, start with support bedtime ritual, creation of restful environment, promote comfort and relaxation, and go while your mind is ready for sleep, away from any anxiety. Then if it is impossible in this case, you can use the medication. This is the end of our session. Thank you for tolerance of this session.